Hey everyone, Adnan Iqbal here, and welcome to another amazing episode of Digital Health on Air. Today I'm joined by Dr. Adel Elsayed. Adel is a board certified psychiatrist as well as an assistant professor at the University of South Florida. And he is a soon to be author as well. And so, what makes Adel's perspective especially interesting is that before medicine, he trained as an engineer. And that systems background has really shaped how he thinks about one of healthcare's most persistent challenges, which is healthcare provider burnout. Something that we of course know all of us who are intimately in the healthcare space, but now of course makes the headlines across the world. And so in this conversation, we'll really go beyond just burnout as a personal issue and something that's like clickbait, but really to talk about it as a capacity and design problem. And we'll explore why it's persisted for so long, what leaders may be underestimating, and really what can actually be redesigned. So Adel will wear his engineering hat as well to support people who are delivering care. So super excited to have you with us, Dr. Al Sayed.
Well, thank you so much for being here, and I appreciate it.
Yeah.
I very much
Yeah, I'll say
appreciate that.
fun fact for our listeners. Adele and I, when we were in our younger days, him as an engineer and me as a biologist, we were cube mates, right next to each other at Genentech. So, which at the time was, at the cutting edge of medical innovation, rewriting medical textbooks. And so the two of us used to get our nerd on, as well as our eat on, together, back in South San Francisco. So thank you so much for joining us.
It's a pleasure, brother. It's a pleasure.
Awesome. Okay, so welcome. You spent your career really working at the intersection of psychiatry, systems engineering, and quality improvement. And so, look, you've worn a lot of different hats. You still wear many hats. Like, really, what first drew you to thinking about burnout, not just as something you may have experienced firsthand as a provider or through your peers, but really through a systems lens?
Yeah. I mean, once you're an engineer, essentially. So for me, having learned the engineering ways and having become a Lean Six Sigma specialist at Genentech, it made me look at the world from that lens. There's typically not just a one-on-one interaction. There's a lot more complexity to every place that we're walking into. And so when I had the great privilege of pursuing my medical degree, I kept these lenses on. And as I was pursuing it year after year, I could not really negate or kind of eliminate the possibilities that I was seeing for improvements from year after year. And so once I was able to walk through that process and actually convince some of my colleagues, and even before graduating residency, I was actually delivering lectures to my colleagues about how to look at things from a system standpoint. It was natural to me. And one of the things that made me pursue, particularly the burnout, is looking at the different layer of the patient populations that we're seeing mental health professionals to
Mm.
not be per se the folks who've had any challenging childhood or traumas that they had to face later on. It can actually be sometimes who are but the professionals who are pushing beyond their own capabilities or capacities, if you will. And so the engineer in me kind of had a light bulb turn on, and I started pulling into that string. And it took some time. Actually, I was taking notes of my observations for 4 years. I started writing things down, drawing different things, and validating them. In fact, it was some things that I was discussing with my own patients as more of like our treatment plan. I started developing a model, validating that model, and thankfully, it came down to it becoming something that I can write about, and that's what allowed me to venture into the process of writing this book on burnout. It took about a year and a half so far, and I look forward to seeing it getting published over the coming months to try to undo this from an engineering standpoint. Thinking about it, it's not necessarily a one aspect; it's a multifactorial, and I look forward to exploring that with you, maybe with future questions.
Yeah. Okay. Awesome. Well, thank you for like teeing up the journey you had to get here. Uh, Look, provider burnout's been talked about for years, right? And obviously, the pandemic really brought it to the forefront for all of us, just as people who were trying to access healthcare in a way that we probably never tried to access healthcare before, right? I think that a COVID vaccine appointment was hotter than a Taylor Swift or Beyonce concert ticket, right? And so, which is not usually where healthcare is. Usually, we're nudging and cajoling people to come in and take care of themselves. And so, uh, an important topic, a prevalent topic. One of our previous guests, Dr. Tina Shah, who used to be at Commune, she's now running for Congress. She's talked a lot about burnout. How serious is this problem still today, especially and for our audience, right? Healthcare system leaders, clinic network leaders, like how should they be thinking about it?
Yeah, it's unfortunately a lot more prevalent than people know or think without you exploring it. Um, when the thought struck me to try to explore this topic, I wanted to just know what the prevalence are in the different
Uh,
domains, whether between physicians, firefighters, frontline individuals, or basically at the forefront of potential burnout. I'm looking at nursing staff, I'm looking at lawyers, teachers,
mhm.
K through 12, and each one of those segments, unfortunately, are actually having pretty high percentages. We're going from 40 to 50%,
Hmm.
depending on the sector. And so that's quite alarming. And actually, looking even beyond that, US employees at large are at a higher risk for burnout than other countries. So it really tells you there's a few signals there. Is it actually the job versus the culture versus more? Is what made me start to think there's a lot more to this, and as we work through our own professions, we get to look at it from our own colleagues as well. Yeah, it doesn't have to be the patient that comes through your door. It could be individuals working next door, people who maybe leaving the organization altogether, and so forth. We work in very tough jobs, and if the job or the schematics and the scope of the job and the individual not aware of the susceptibility for walking into burnout and having preventative measures for how to first recognize it or treat it, then you're walking into with a very high risk for potentially losing an employee. And that can be
Hmm.
a much more higher problem for employers and employee of equal size, if you will, for them to have to find another job, if you will. So it's quite prevalent, and looking at the alarming numbers, it made me curious to learn more and try to reverse engineer it, if you will.
Yeah. Okay. Super relevant. Look, we hear consistently from health system leaders across the country and really now across the world that folks have joined this profession, a profession of real meaning and impact, for the calling. And of course, they're struggling now with retaining folks
Mhm.
and ensuring that their work does have that meaning, and it's not just manual things or things that people have to push through or checklists that they have to power through. Provider burnout is real. Care team burnout is real. You've talked about the prevalence. You touched upon some of the root causes, but from your perspective, like, just what are we getting wrong and how we've tried to address it thus far?
Yeah, so there's a simple perspective, an engineering perspective, where they say if you're trying to fix a problem and the problem is not fixed, that means you're looking at it from the wrong perspective. That means you're pulling on the wrong strings. Um, and that just goes through the whole design process for when you're designing something to try to achieve a particular goal, whether it's a customer satisfaction or what have you, and whatever you design does not fulfill that. What does that tell you? You designed the wrong thing. You designed the wrong
Yeah.
product. And that goes through the verification and validation from an engineering standpoint. And looking at this, though, as an engineering complex problem, if the things that we've have already put out there as far as solutions are not fixing it, what does that tell you? That means we're fixing the wrong problems. We're fixing the
Hmm.
wrong root causes, and we got to take a look at it from a different angle. And the way I can try to bring it to perspective, current definitions for burnout, if you were to take a look at the World Health Organization or the Maslow inventories, it gives you the perspective that burnout has to do with job-related stress. It's a job that causes the stress that causes the burnout. Now, my argument is, so would that tell you that individuals who don't have jobs don't experience work burnout?
Hmm.
And the answer is hopefully no, right? So what does that
Yeah.
tell you? That tell you that particular symptomatology of burnout can be experienced independent of the job. So right there, now we can have two separate discussions. We can have a discussion about how can we make job-related stress less problematic for individuals that they would be resulting in burnout, but at the same time, what makes the individual more susceptible for burnout? And that's something that
Hmm.
hasn't been explored. I'm hoping my book will help open that discussion to allow individuals to understand that each one has their own capacity. Um, your own capacity is different than mine. It's just
Yeah.
like how the fingerprints are in one hand. And so right off the bat, for me to think about that, it gives me an idea of like, okay, so what is my capacity? And then you're going to start asking the questions. So what's pouring into that capacity that allows it to be maximized, and what's overshooting it? And then we can start thinking about different solutions from there.
Yeah. Okay. So in reading your book, I mean, clearly you touched upon burnout as a capacity problem, right? And so, uh, walk me through what does it actually mean in practical terms for healthcare leaders,
Yeah.
and
Yeah.
and really, uh, give us your thoughts around like employers who could incorporate this more individualized look at an employee or member of their team's capacity.
Oh, absolutely. So the model comes down to it's a very simple way to try to just picture it. It's essentially looking at your capacity is something that we can label as a bucket size. And this particular bucket size is very unique to you. You're essentially sometimes born with it to many different aspects, from genetic predisposition, the way you were raised up from a family dynamic standpoint, your temperament, your socioeconomical status, and whether you're carrying any particular chronic medical conditions. That allows you to have this bucket, and this is the bucket size for you now.
Wow.
Now, I want you to imagine all the different stressors in your life that you're experiencing are separate faucets that are pouring into this model. Each faucet has its own name, has its own unique frequency, if you will, volume, and how
Yeah.
often it's been happening in your life. And so some of these faucets are dripping all year, some are gushing through in one particular incident. And at some point, your bucket gets full to the brim. Now, the question is, what happens when the next drop comes? That next drop comes and causes a spell. And this is what we label as a major life crisis. This is when you're experiencing essentially mental health disorders, depression, anxiety, and other things go from that particular perspective, including burnout. So now the question is, I get a lot of people asking, hey, doc, that last drop that came in never used to cause me any issues.
Hmm.
Why is it causing me issues? Now, when I tell them it's not about the drop, it's about everything else in that bucket. And so when we try to understand this particular schematic, there are three solutions to this. If you're thinking about faucets pouring into a bucket that's overspelling and you want to avoid the overspelling, there are three dimensions. One could be, can I control what's coming in? Right? Is
Hmm.
there any way that I could try to turn off or even reduce some of those particular faucets that are coming in? All right, that's a great solution. Second solution is, can I drain this? Can I pour a hole into this bucket to make it drain faster than it's coming in? So that way it's not overfilling. That's easy. And then the third one is, can I get a bigger bucket? And
Hmm.
actually, one of my patients, the one that proposed that as I was validating this model, I said, you know what? There are ways to think about that. There are ways to try and think about how can you get a bigger bucket over time, but it requires a lot more work. So each one of
Yeah.
these dimensions is actually backed up with science to the moon, if you will. There are different ways for us to look at that. For the top ones, as far as faucets, if you're thinking about solutions for this, is that you need to first understand what are the stressors in your life, put names to them. Recognition, insight is a major part of this. And then within that realm, you go into a deeper level where you're actually separating out the controllables from the uncontrollables. So the controllables, this is maybe where some of the work-related factors can belong into, where you're actually trying to understand are different things that I'm accepting into my own job role. The commute, for instance, can I ask for accommodations? There are different things there that could try to reduce that faucet that is labeled work. But there are many other faucets in here, right? So we're talking about other life-related faucets. And in here also belongs social media and news and other things that are can be detrimental for how you balance yourself from a work-life balance standpoint, and trying to keep your mind as clear as possible to trying to achieve your personal goals or priorities. So that's the controllable piece. And this is how the employers can be intervening, but also understanding the human here, the human side of all this. And looking at it from that lens would allow their employees to try and explore these other things. Some of the uncontrollables could be some things that are beyond your own capacity to try to modify, whether you have in a particular, your parents are ill, some things that could be basically some things you have to be at peace with. We call it, you can achieve radical acceptance from what
Mm.
destined shall be. And trying to actually practice that reframing is quite important, and it can take some time for someone to exercise, but that's the solution to this. Right? And then we're talking about the second dimension, which is drains. This is extremely, extremely important. Some of the drains that you may have heard about, and a lot of people speak about, are your sleep, your exercise, your diet, and the other aspects that I add on as well in my book is about socialization. We're meant to also be social. I'm not talking about social media. I think there's a lot of negative ramifications of people thinking social media allows for socializations the way that we human need it. Um, there also some time for meditation and self-reflection. You need to have that lone time and you need to have that social time. So these are some of the drains, and understanding how you can develop habits from them is the bottom line, and or undo some of the bad habits that you may have developed. So that's the dimension there. And
Yeah.
as far as your capacity, this is the one that I was referring to as far as knowing a little bit more about who you are and how you came about to be. So this is looking at your family history, looking at your own childhood, whether you faced any particular complications or if you will, major traumas, some things that have happened to you up to now would allow to understand this is what I'm living with. Knowing that, you can start stretching this once you undo some of the complications, if that's something you've ever faced in the past. So this is the
Yeah.
model, if you will, in general, right? So thinking about that and walking away with it, I tell you, Adnan, like when I voice this, I've had many wonderful opportunities actually presenting this to different people from different walks of life, and the impact has been quite refreshing. Actually, in fact, I was just in a conference last week, and one of the members is an engineer who came to me the next day and said, "I've had many different reasons for me to have faced multiple complications and have had mental health challenges. But last night, I've had probably one of the best nights of sleep.
Mm.
After attending one of the workshops that was facilitated and discussing this at a lot more in length and in depth, and I had certain workshops and worksheets, if you will, for them to fill out and trying to exercise for themselves. Others are quite refreshing when you get to see some of my clients come to me and tell me, "Hey doc, I messed up. My bucket overfilled because this faucet was pouring and that drain was stuck, and so I ended up here." And I said, "Oh my goodness, you've just solved your own problem. You were able to identify it. You found out where the issues are coming from. So what are we gonna do about it?" And it makes the turning the corner as far as treatment and getting better much faster.
Amazing. Uh, Dr. Elsayed, you are a parent's dream, especially an Asian parent's dream. You're an engineer, a physician, and a practicing physician who's delivering impact to real patients. And now you're also an author, right? And so you've written a book called Burnout, Where the Head Goes and the Body Follows. Um, I want to bring this back to our audience who are health system leaders who I know I hear from who talk about burnout as real. Um, just make this real for us in terms of tangible things, right? Like clearly you touched upon how this isn't a one size fits all approach to the capacity or bucket concept. It's not a personal problem in terms of like, oh, you got to be more resilient or indulge in some self care or here are these automation tools. But how can an organization, how can health system leaders approach the actual workday of
Mhm.
clinicians, nurses, care team providers? Like, what are some tangible things for them that you want them to hear?
Yeah, and I think at first I'm humbled that you've given me that background. I just pursue my passion, and thankfully I've had great people that have been able to give me guidance about what could be the next step for my own educational development, if you will. So I'm grateful to be here. I'm grateful to also give back and provide some insight. So talking to leaders, healthcare leaders, to try
Yeah,
to think about
give us like the impactful stuff that
systematically
we're yeah, yeah.
assess it, assess it. Know it's out there. So right off the bat, I would say this is one thing. If you're asking about your metrics, if you're thinking about why this particular organization or that group or that particular entity is not turning a corner as far as culture, one aspect of it could be is because of there's an underlying struggle with burning out. And for you to first need to assess it. So understand the baseline, get some measurements, get some baseline assessment. There are many assessments out there that could be given from an employee health standpoint that you can survey and get
Yep.
that feedback. When you get that employee feedback, it opens up so many different doors because from that feedback, you're able to tell, are these employee specific things that could be addressed through work-life balance, whether you're having a hybrid model of scheduling or what have you, or having additional supplemental assisting groups that could be assisting the primary positions, whether a physician or other people or the front line that require additional administrative support. That could give you a different strategy for solution. The other aspect could be of just the way the operations are running. And this is where the operation engineer in me is itching to try to assess, because some things that I also do in the various organizations that I lead quality improvement projects for is, are you understanding your capabilities, your system capabilities? It's always good to think about, I could do more with less. And I get that. Who
Hmm.
doesn't? But it's a lot more humbling for you to know, you know what? I'm good. It's actually quite humbling for you to get to see I am good at this level because I do not want to push my own employees or my own organization beyond their comfort level, because the idea is that I want to retain people. I'm not here to treat for the sake of a metric. I'm here to try to build the organization and build the life for employees that they can feel good about coming to work. We spend more time at work than at home, Adnan, right?
Yeah, absolutely.
So who would not wish to have that particular lifestyle where you're looking forward to work because you know you're not getting pushed to the wall, but rather you're being looked for as a human, as part of a
Yeah.
team, and your own mental well-being and your own capabilities for you to enjoy working instead of being pushed against the wall to get the output and the outcome for the bottom line at the end of the day. It's quite challenging. And so I understand. I understand leadership perspective when you're looking at, there are certain metrics, there are certain numbers, there are certain success criteria that they have at the beginning of the year, at the end of the year, they got to make. I would say now make an additional metric in there for assessing
Yeah.
employee burnout, because you want to have that as a balance. Key performance indicator, if you will. You don't want to lose the ball on
Yeah.
this one. You can win a lot of different metrics out there, but if you lose your employees, you use your identity, right?
Yeah. Okay. So this is super helpful. So assess and measure most, and then use that to really guide solutioning.
Yeah,
And that'll vary based on what you're assessing and measuring and what your data tells you.
exactly.
Awesome. Um, Dr. Elsayed, this has been awesome. I enjoyed our conversation, leading up to today, and of course today. And I know, like I mentioned, our listeners, burnout is top of mind for their employees, their providers, their care team members, and so I'm excited for them to be able to pick up burnout where the head goes and the body follows here shortly. But you know me, I like to leave folks with a little bit of hope. So very real problem, clearly very prevalent. You've shared some practical tips, but give us like a little sense of is it getting better? Like in your experience, are things getting better?
Yeah, I think the folks are starting to have more conversation about this. Just like how mental health was a stigma for us to speak about
Hmm.
just a few years ago, and now it's become a lot more easier. It's much easier for us to have a conversation about seeking out mental health assistance or what have you. People are more open to talk about that, and more open to try to explore different treatment modalities in that regard. I feel like we're also turning the corner on this. From an organization standpoint, people are starting to have the conversation, especially with COVID. You said it. The COVID really was the engine tester for us. It tested so many different engines for us. Um, and it helped us leap into many different modalities we never thought could be done, which is working virtually and having particular proficiency working in that particular modality. And so, and people started to recognize the work-life balance could be actually captured through a virtual model or something of that nature. So it kind of pushed what is possible. And now organizations are more open to try to also explore, okay, thinking about the human aspect of things. And I've seen this in many different organizations with great leaders who take this very seriously. They're like, okay, I'm going to take a look at my own employees. And it's not about only the numbers, it's also about taking care of my own people. And so um, I'm hopeful. I wouldn't feel this way if I don't have a good sense that this is something that we can turn the corner on. And I'm hoping that the particular content that I've created, and people can check out the particular website for the book is thebucketmodel.com. In the meantime, until it comes out, is that we are also trying to provide assistance, not to only the employers, but also the employees. Everybody can take hopefully something away from this. And that's my hope. That's my wish, is that some of this information could provide more insight to individuals that they can lead a better life walking away from it before they were able to read this. So I look forward to
Awesome.
seeing what we're going to do with
Let's
that. And
go.
hopefully we can have a part two, Adnan, where we get to have some organizations kind of testimonials and endorsements about, okay, there are some things here that we're able to implement, and hopefully we'll get to see the realization of it at the end of it.
Awesome. Well, thank you for the work you do as a healthcare and mental behavioral health provider. Thank you for your leadership on this topic and for giving us practical tips here for us to take away into all our organizations, whether directly healthcare or not. This has been awesome. Thank you so much for being generous with your time and your insights. This was a lot of fun. Thank you
It's
so
my
much.
absolute pleasure. Thank you so much, Adnan. You have a great day.
You as well. Bye, guys.